Hi everyone, how are you? Today I want to talk about a super important topic that affects many people, but doesn't always get the attention it deserves: alopecia. Have you heard of it? If you're noticing that your hair is falling out more than normal, or know someone who is going through this video is for you. I'm going to explain what alopecia is, what the most common types are, the possible causes, treatments, and even how to deal with the emotional impacts of this condition. So like the video, subscribe to the channel and come with me. So folks, alopecia is a term we use to talk about hair loss in different parts of the body. And you know what's interesting? Alopecia is not a single disease. In fact, it is a symptom that can have several causes. Some people lose their hair in small, rounded areas. Others have more diffuse hair loss, or even complete loss of all their hair or body hair. Now, why does this happen? In many cases, alopecia can be related to genetic, hormonal, autoimmune factors, or even stress. For example, androgenetic alopecia, which is super common, has a lot to do with genetics and hormones. Alopecia areata is an autoimmune disease where the body starts to attack its own hair follicles, as if they were enemies. Let's talk about the most common types of alopecia, so you can understand better. Keycap 1: Alopecia areata. This is a type that causes areas of hairlessness, usually round on the scalp or other parts of the body. It can be temporary or evolve into more serious forms, such as alopecia totalis, which affects the entire scalp, or universalis, which affects all body hair. Keycap 2: Androgenetic alopecia. This is the famous genetic baldness. It is more common in men, but it also occurs in women. In men, it usually starts with receding hairlines or thinning on the top of the head. In women, it is more diffuse, with the hair becoming thinner overall. Keycap 3: Telogen effluvium. This complicated name is basically a temporary hair loss caused by factors such as stress, illness, postpartum, or even a poor diet. It is usually something that resolves itself over time, but it is important to treat the cause. Keycap 4: Cicatricial alopecia. This is more serious because it occurs when there is permanent damage to the follicles, whether due to inflammation, trauma, or even autoimmune diseases. Unfortunately, hair no longer grows in the affected areas. Now that you know the types, let's talk about the causes. Alopecia can be caused by many things, from genetic and hormonal factors to autoimmune diseases, stress, infections, or the use of very aggressive chemical products. That's why diagnosis is super important. If you notice that you are losing hair abnormally, see a dermatologist. The doctor can perform scalp exams, request a biopsy, or even blood tests to identify the exact cause. And this is essential, because the treatment will depend a lot on the type and cause of your alopecia. Now, the part that everyone wants to know: the treatments. There are several options, and some work very well, depending on the case. For those with androgenetic alopecia, for example, products such as minoxidil and medications such as finasteride help a lot. For alopecia areata, treatment may involve the use of corticosteroids or immunomodulatory medications. And if you want something more advanced, there are therapies such as hair transplants, PRP, which is platelet-rich plasma, and even the use of low-intensity lasers to stimulate hair growth. But that's not all. Self-care makes a big difference. Having a balanced diet, avoiding harsh products on your hair, and managing stress are fundamental steps to keeping your hair healthy. Sometimes, what seems like a big problem has a simpler solution than we imagine. Lastly, folks, I want to talk about something that many people forget: the emotional impact of alopecia. Losing your hair can be very difficult and can have a huge impact on your self-esteem. It's important to remember that true beauty comes from within, and there are resources, such as therapy or support groups, that can help you cope better. If you're struggling with alopecia, know that you're not alone. And if you know someone who is in this situation, share this video so that they too know that there is information and solutions available. Together, we can create a support network to overcome any challenge. If this content helped you, leave your like, subscribe to the channel, and activate the bell so you don't miss any new videos. I will continue to bring tips and information about health, well-being, and quality of life. And comment below: have you ever faced or know someone who has faced alopecia? Let's exchange ideas and experiences. Oh, and share this video with someone who can benefit from this information. See you in the next video.